It's been less than 2 weeks since the Supreme Court overturned Roe, and we're already seeing the impacts, like this. This incident, first reported by the Indianapolis Star-Tribune, of a pregnant 10-year-old girl who was allegedly denied an abortion in Ohio because the state immediately banned all abortions after 6 weeks. The 10-year-old was 6 weeks and 3 days pregnant at the time she was seeking an abortion. It appears the girl was scheduled to travel to Indiana to receive care last week. Remember, Indiana is a state with a Republican governor and a GOP-led legislature that's expected to further restrict or ban abortion as soon as later this month, right? That is the state that we're headed towards. So joining me now is Dr. Jessica Shepard. She's an OBGYN in Texas and the Chief Medical Officer at Verywell Health. Doctor, thank you so much for being with us today. I want to start with your reaction, right? What was your reaction when you heard the story of the 10-year-old girl that is literally driving across state lines to flee?
You know, this is kind of unreprehensible. And I think that this is what we're going to start to see. Like you said, we're 10 days out from this overturning. And these are the types of stories that we're going to hear more and more of. And the reason why this is important is because when you actually restrict laws, it does not make it healthier or safer for women to get the care that they need. What we're going to start to see is that there's going to be more unsafe abortion care, and also for abortion providers who have really trained to do these types of procedures are going to be overworked, because now there are going to be states that allow these people into the state, which for right reasons is going to have an undue process and a kind of overworking these abortion care providers, and that's going to clog the system.
You said that, right? I think providers will be overworked. Part of that is due to the fact that there's going to be this massive surge of out-of-state patients crossing state lines, right, like the 10-year-old girl, to seek care. So do you think that clinics and some of these states have the infrastructure and the capacity to take on this work?
I absolutely think they do not, because this is not how the care was intended when we started to build these clinics and offices and also hospitals that give safe and legal abortion services. It really was, again, when we think of Roe versus Wade 50 years ago, was to allow the country to give abortion care. So now that we've restricted that, what we're going to see is that there's going to be really important negative health outcomes, such as this one that we're seeing here. And again, looking at that very slight time frame, and when we think of the Ohio abortion ban, it really is at 6 weeks and when you would see a heartbeat. So technically, she was just past, possibly, you know, not knowing the full story, past that 6 week time frame, and now we're having to shuttle a 10-year-old across state lines. Think of the emotional impact for her and her family having to go through that in order to get the care that she needs.
You know, you said that people will be facing negative health outcomes, right? I think it's important to spell out, you know, and to almost give us a visual image of what that means. What are some of the consequences that we can start seeing because of these types of legislations and because we're living in a post-Roe America?
Yeah, you know, typically what we'll start to see is that time frame, right? That time frame is only going to increase because, one, someone may have to travel. And then also, again, from the provider standpoint, we're going to have kind of a overworking. So that's going to increase the wait time to get the service. So if you're thinking of someone who has made a decision maybe very early on in their first trimester and now has to wait maybe into their second trimester, their early second trimester, or even mid to get the care that they need, that's going to increase the risk of, again, that from a surgical standpoint of a surgical procedure, risk of infection, bleeding, you know, and this is what we're going to start to see from a medical perspective, but also the emotional turmoil that it's going to take on people just to take the planning that goes into effect. And last but not least, there are reasons outside of just people thinking they want an abortion, which again is still fine. There are medical reasons that may put the mother's health at risk. And that time frame sometimes is very precious in going from something that can be a bad outcome to a very severe bad outcome, potential mortality.
For decades, obviously, people have also resorted to abortion pills, right, to access abortions. What does this post-Roe America mean for abortion pills, right, for the access to that?
Yeah, we're already starting to see some of that in the pharmacies because, again, it goes to what is the medication being used for. There are medications actually that are used for medical abortions that can be used for other medical conditions. And so what we are going to start to see is that chaos and confusion for the prescribing physician to the patient, and also from the pharmacy perspective. Do they allow that patient to get the medication, whether it is for an actual intended medical abortion or if it's for another medical procedure? That's where we're going to start to see some of those hangups. And I've already, seen some stories across the country where pharmacists have been told by their company that they cannot give any medications, again, that lead to what we typically prescribe for a medical abortion. We're going to see a lot of chaos and confusion and a lot of emotional turmoil from everybody who's involved.
Dr. Jessica Shepard, thank you so much. You're in the eye of the storm. You're on the ground. So thank you so much for all your work.
Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.